All right. So as I said, you have only 15 minutes. So if you want to read all these texts in detail, you will waste your time. You will not be able to finish part A in 15 minutes, because imagine if you read all these texts, you will take at least 5 or 6 minutes if somebody wants to read it in detail. Now, different people have different strategies. Some people just do skimming and scamming. Um, Scamming and skimming, sorry, mixed my words. Some people do that, which if that technique suit them, it is okay for them. But I just don't want you to waste your time. So what I would suggest you to do is just read the titles and subtitles in the texts. So for example, if you just want to read the titles of text A, it says fractures, dislocation, and sprain, right? So you need to know that in text A, they have talked about fractures, dislocation, and sprains. So in text A, they talk about the definition of these conditions: fractures, dislocation, and sprain. You don't need to read the rest of the words. You just read fractures, dislocation, and sprain. Then go to text number B. If you look at text B, it says simple fracture of limbs, immediate management, clinical assessment, examination, and again management. So you should know if in any question they talk about or they ask about management, assessment, or simple fracture of limbs. So if they ask any question related to these things, you need to come to text B. Your answer should be in text B. And as I said about text A, if there is any question that is related to the definition of fracture, dislocation, or sprain, you need to come directly to text A. Your answer should be here. So you don't need to waste your time. Imagine if you just read fracture, dislocation, and sprain, it will take you maybe 10 seconds or 15 seconds, not more than that. So you're saving your time. Now coming to text B, is you see it says immediate management, clinical assessment, and management split to the side. Okay, so if question is related to management, you would come directly to text B. Now, if you look at text C, drug therapy protocol, so you don't need to go through the whole part of this text C. You don't need to go into the details. You just know that if they ask anything about treatment, medicine, or anything related to medication, you would come straight to text C. So that is something we are, and you need to look at the information down here as well. Sometimes the questions will be related to it. If you, for example, if you look at respiratory depression is rare, if it should occur, give naloxone. So this is something they may ask you. Now coming to text D, technique for plaster backslave for arm fracture. Use same principle for leg fracture. So if you look at it, you don't need to go through the details. You don't need to go through from 1 to 8. If you look at the points in it, you don't need to go through all of them. You just know that if there is anything about technique for plaster backslave of arm fracture, etc., so you would come straight to text D. So it will take you maybe 40 seconds or 45 seconds in total to read the titles and subtitles of all the texts from A to D. Now we will go to questions in a minute. Okay, so now as I told you earlier, what you need to do is You need to skip question 1 to 7. We will answer it later, because when you answer from 8 to 20, you would already know answers to 1 to 7. So initially, don't waste your time on that. Just go to question number 8. So it says, what should be used to elevate a patient's fractured leg? So can somebody tell me which text should we go to find information or find answer to this question? Can somebody tell me in the comment section, in the chat section? Remember the question, it says, what should be used to elevate a patient's fractured leg? Okay, I'm getting answers there. Management, text B. So now let's go there. I think you're understanding it well. What should be used to elevate a patient's fractured leg? Remember the question. So, as you said, it's in text B. Immediate management. We need to go through, then at this time, you need to go through all the information. If you think you can't point out the answer right away, you need to go through the whole information quickly, just read it quickly. But if you think you can find the information, that's up to you. But anyways, we can go to the management, to the lower part. As you guys said in the chat section that we need to go to text B, we are in the text B. And if you look at the management, it says splint the site of the fracture, dislocation using a plaster bag slab to reduce pain, elevate the limb, a sling for arm injuries, a pillow for leg injuries. So now, who can tell me the answer? As you can see the information here, it says splint the site of the fracture, dislocation using a plaster bag slab to reduce pain, elevate the limb, a sling for arm injuries, a pillow for leg injuries. If in doubt or injury, treat as a fracture, administer analgesia to patient in severe pain. If not allergic, give morphine. If allergic to morphine, use fentanyl. Consider compartment syndrome where pain is severe and undelivered. So who can tell me the answer? Well, I can see you guys say part B management, second point. You don't need to write the whole bullet point, like you don't need to write the whole sentence. You just would need a word. Remember the question, it said, let me go to the question again. What should be used to elevate a patient's fractured leg? What thing should we use to elevate a patient's fractured leg? Now let's go to text B again. Look at it. So can anybody else answer this question? If you look at it, it says elevate the limb. I can see answers. Okay, so if you look at it here, elevate the limbs, a sling for arm injuries, a pillow for leg injuries. So it's really important. You need to pay attention. Some people may write a sling, but a sling is for arm injuries, and a pillow for leg injuries. So you can write a pillow, or you can also write pillows. Both are correct. So you don't need to change the spelling or anything. What I would suggest to you is just write a pillow, just write this one, copy and paste it there. That is your answer. Well, sling we cannot use, Rafiq. As I told you, sling is used for arm injuries. If you look at it, a sling for arm injuries, a pillow for leg injuries, and the question is related to leg injuries. So well done, guys. It seems like you guys are understanding what I'm trying to explain. Now let's go to question number 9. Okay, so question, what is the maximum dose of morphine per kilo of a patient weight that can be given using the intramuscular route? So what is the maximum dose of morphine per kilo? Very important. Sometimes they might have written the total dose of morphine, but here it says per kilo, per kg. What is the maximum dose of morphine per kilo of a patient's weight that can be given using the intramuscular route? So what is the maximum dose of morphine that we can give intramuscularly to a patient according to their weight? So how much can we give per kilogram, per kg? So this question is talking about medicine. So which text should we go to? Can somebody tell me which text should we go to? Okay, text C, I think Rafiq says text C. Other person, Raza, says text C. All right, so let's go to text C. So text C is about medication. Now let's see about morphine. It asked about morphine. So who can tell me the answer? Look at morphine, drug, form, ampule, strength 10. Some people might write 10 milligram per ml, which is incorrect because 10 milligram is the total dose that the ampule has. 1 ml is 1 ml contains 10 milligram. So we don't need to write this. If you go to intramuscular route of administration, IM, and recommended dose. So who can tell me which could be the answer? You need to keep everything in mind. Raza says 10 milligram. There is a point. You remember I told you it's per kilogram, per kg. It's not the total dose, it's the maximum dose per kg. Per kilogram. So 10 milligram is not per kilogram. 10 milligram is per ml. So this is not the correct answer. Who else would like to answer? You can see the screen. What is the maximum dose that we can give intramuscularly per kg according to a patient's weight? So I'm just waiting if you guys can answer. Even if you don't know the answer, just put it there. This is practice session. Well, Rafiq, you need to give me one answer because 0.1 to 0.2, these are two answers. So they ask for one. What is the maximum dose? So you can't really, put both of them there. You can just put one. Okay, let me tell you the answer. How to find this answer? You don't need to panic too much. Just look at it. You know the drug name morphine, that's correct. Ampule, strength is this much. Now here is our answer. It says intramuscularly. This is IM and this is IV. So we don't need to worry about the IV part. We need to just focus on the IM part. It says IM or subcutaneous. So if you look at this one, 0.1 is the minimum dose, 0.2 is the higher dose. It says 0.2 mg per kg to a maximum of 10 milligram. Now this 10 milligram is not according to per kg. This is the maximum dose that you can give to any patient, no matter uh, how much their weight is. You cannot go further from 10 milligram. So this is not per kg. This is about the full body of the patient. No, maybe 70 kilogram would be the weight of the patient. So this is not something that you need to put there. Your answer should be 0.2 milligram per kg. This is related to your question. I hope it's clear. This is clear for you guys. Now let's go to question number 9. Was it 9? Oh, we did 9. Which part of a limb may need extra padding? So this is kind of tricky. Which text do you think we can answer this question from? So in which text can we find this? In which text can we find an answer to this question? Can somebody tell me? Which part of a limb may need extra padding? Let's go to our texts. This text, if you look at text, this one, okay, so it is talking about techniques and putting plaster to the fracture and to the rest of the body, parts of the body. So if you look at point number 7, okay, one person has answered already. If you look at point number 7, don't apply pressure over bony prominences. Extra padding can be placed over bony prominences if applicable. So anybody else would like to answer it? Who else can see the answer? Who else can see answer to this question? So one person has answered this question. They said bony prominences, and the answer is correct. So that is how you find answer to these questions. You just need to know about the text, which information can you find in a certain text, and then you can go straight to them. Now let's go to question number. Which part of limb? Okay, that one is done. What should be used to treat a patient What should be used to treat a patient who suffers respiratory depression? So, in which text can we find this information? Answer to this question. This one could be a little bit tricky, so I have not shown the text yet, and you guys are answering it already. Anyways, let me go to the text. If somebody suffers from respiratory depression, what should we give to that patient? If you look at the text about medication, and if you look at the last part, it says respiratory depression is rare. If it should occur, give naloxone. So answer to this question is naloxone. You can just give this medication if somebody has respiratory depression. And what you can do is just copy this word from here and just put it in the answer section. Now we need to be a little bit quick. We just have little time left. Okay. Question number 12. What should be used to cover a freshly applied plaster backslab? I think you all know in which text can we find this information. It's about plaster backslab and those things. So can somebody tell me quickly which text should we go to? Well, if you guys have questions, please put it in the chat section. I will try my best to answer your questions. Pulmonary or pulmonary tuberculosis. Note, as the word tuberculosis has already mentioned in the question, well, I think it depends on whatever answer is available in the text. If the text says pulmonary, you just need to put pulmonary. But if the text says pulmonary tuberculosis, then you need to put the whole word there. As I said, in reading, you don't need to change anything. You just need to copy the words from there and put it there. If the text says pulmonary tuberculosis, just put the whole word there. All right, so what should we use to cover freshly applied plaster backslab? What can we use for covering it? Now let's go to text, this one. So if you guys could read it and then let me know the answer. So what do you think is answer to that question? What should be used to cover freshly plaster backslab or whatever it was? Okay, if you look at it, if you look at point number 8, it says wrap crepe bandage firmly around plaster backslab. So it does not say about freshly, but it still has answer to the rest of the question. As we cannot find any better answer, so we need to go with that one. What should be used to cover a freshly applied plaster backslab? So answer to this one is crepe bandage. You can just put crepe bandage here. And what should be used to cover freshly? All right. So question number 13, what analgesic should be given to a patient who is allergic to morphine? So if somebody is allergic to morphine, what can we give? So as you might know by now that we need to go to text about medication. So if somebody is allergic to morphine, what can we give? I don't know if we can find answer to this question in that part, but still we can give it a go. Drug therapy. Authorized worker must consider a nurse practitioner, screen more nurse proceed. Okay, so we don't have answer to that question. If somebody is allergic to morphine, what can we give? Drug therapy protocol authorized must consult medical officer or nurse practitioner, give medicine rule and a slide practice registered nurse. Adult that much. Okay, so this time the answer is not in text C. We may need to have a look at text A. Okay, if we look at management, sometimes answers could be like this, like maybe one or two of your questions might be in a different text that you might think would be. Like for example, if you want to go to text C that is about medicine, but when they asked about if somebody is allergic to morphine, what should you give? So that answer is not available in that text. Sometimes it may happen. You need to be, reluctant to it, that you can go to another task. So if you look at management here, it says administer analgesia to patient in severe pain. If not allergic, give morphine, preferable. If allergic to morphine, use fentanyl. So answer to that question is fentanyl. You can just write fentanyl in your answer. So I think we just have 1.5 minutes left. That is the strategy for it. If you go through all the questions like this, and by now you would know where you would find information to question number 1 to 7, procedure for delivering pain relief, that you know by now what you need to do, the procedure to follow when splinting a fractured limb, what to record when assessing a patient, the term used to describe different types of fracture, the practitioner who administers analgesics. So you know where these information come from. You already know that by now because we have gone through the texts already, not completely, but most of them, as we have answered a few questions. So the point of this is the strategy that you need to follow, and that is how you tackle part A of reading. So we will arrange a next session for it as well. I would like you guys to attend that one as well. Just in case if you have any questions, you can ask us in the group. I'm there to answer your questions, and you can message me personally as well. But we will definitely arrange another session for reading about the rest of the parts. This is quite lengthy, and it's not possible to cover them all in one session, as we have part A, B, and C. So we have a lot of things to do in part A, like these questions that you can see, and then we will discuss about part B separately in different session, and then we will talk about part C in a different session. So stay tuned with us, and if you have learned something from this session about part A, I